Welcome to this comprehensive guide on blood glucose monitoring techniques. Understanding how to monitor blood glucose is essential for anyone living with diabetes as well as for healthcare professionals supporting diabetic patients. Accurate blood glucose monitoring helps guide daily decisions about food activity, medications, and overall diabetes management. It is also vital for preventing both short-term complications like hypoglycemia and hyperglycemia, and long-term complications such as nerve damage, kidney disease, and vision loss. Blood glucose monitoring refers to the process of measuring the amount of glucose or sugar in the blood. Glucose is the body's main source of energy, and its levels are tightly regulated by hormones such as insulin and glucagon. People with diabetes either do not produce enough insulin or their bodies do not use insulin effectively, leading to elevated blood glucose levels. Regular monitoring gives a real-time picture of how well diabetes is being managed and allows for timely adjustments in treatment. There are several techniques for monitoring blood glucose. The most common is self-monitoring of blood glucose using a portable device called a glucometer or blood glucose meter. This device allows individuals to check their blood sugar at home, at work, or anywhere they need to. The process is simple but requires attention to detail to ensure accurate results. To use a glucometer, first gather all necessary supplies. These usually include the meter itself, test strips, a lancing device, and lancets, which are small needles used to obtain a drop of blood. Begin by washing your hands thoroughly with soap and warm water. Dry them completely, as wet hands can dilute the blood sample and lead to inaccurate readings. Some people use alcohol wipes to clean the finger, but it is important to let the alcohol dry fully before testing. Insert a new test strip into the glucometer. The device will usually turn on automatically or prompt you to do so. Next, prepare the lancing device by inserting a fresh lancet and adjusting the depth setting if needed. Choose a finger for sampling. Most people use the sides of their fingertips, as these areas tend to be less sensitive than the pads. Rotate fingers regularly to avoid soreness and calluses. Hold the lancing device firmly against the side of your finger and press the release button to create a small puncture. Gently squeeze or massage your finger to encourage a drop of blood to form. Touch the tip of the test strip to the blood drop. The glucometer will draw up the blood and begin analyzing the sample. Within a few seconds, the device will display your blood glucose reading. Record your result along with the date, time, and any relevant notes such as recent meals, exercise, medication, or symptoms. Many meters store this information automatically, and some can sync with smartphone apps or computers for easier tracking. Keeping a blood glucose log helps you and your healthcare team identify patterns and make informed decisions about your diabetes management. It is important to follow the manufacturer's instructions for your specific glucometer. Different meters may require different amounts of blood and have varying testing procedures. Using expired or improperly stored test strips can lead to inaccurate readings. Store test strips in their original container and keep them away from heat, moisture, and direct sunlight. Dispose of used lancets and test strips safely in a puncture-proof sharps container. The frequency of self-monitoring depends on the type of diabetes, your treatment plan, and your individual needs. People with type 1 diabetes or those using insulin often check their blood glucose multiple times a day, including before and after meals, before bedtime, and sometimes during the night. People with type 2 diabetes who are not on insulin may test less frequently, but regular monitoring is still important, especially when making changes to medications, diet, or activity. Another technique for monitoring blood glucose is continuous glucose monitoring, or CGM. This technology uses a small sensor inserted under the skin, usually on the abdomen or upper arm. The sensor measures glucose levels in the interstitial fluid, which is the fluid between cells, rather than directly in the blood. The sensor transmits data to a receiver or smartphone app, providing real-time glucose readings and trends throughout the day and night. CGM systems offer several advantages over traditional fingerstick testing. They provide a continuous stream of data showing how glucose levels change in response to meals, exercise, stress, and medications. Many systems have customizable alerts that notify users of high or low glucose levels, allowing for prompt action. Some CGM devices can be integrated with insulin pumps, creating a more automated approach to diabetes management. To use a CGM system, the sensor is inserted using a special applicator. The process is quick and relatively painless. The sensor is held in place by an adhesive patch and can remain in place for several days to a couple of weeks depending on the device. The transmitter sends glucose data wirelessly to a receiver smartphone or smartwatch. Some systems require calibration with fingerstick tests while others are factory calibrated and do not need additional testing. When using a CGM, it is important to understand that readings reflect glucose levels in the interstitial fluid, which may lag behind blood glucose by several minutes. This is especially relevant during rapid changes such as after eating or exercising. For this reason, confirm low or high readings with a fingerstick test if you are unsure or if your symptoms do not match the CGM data. Flash glucose monitoring is another option similar to CGM but with a key difference. Instead of providing continuous real-time data, the user scans the sensor with a reader or smartphone to obtain a glucose reading. Flash monitoring systems are popular for their ease of use and minimal fingerstick requirements. They provide trend data and can store several hours of glucose readings, which can be downloaded and reviewed with your healthcare team. In the hospital or clinic setting, blood glucose may be measured using laboratory techniques or point-of-care testing devices. Laboratory measurement involves drawing a blood sample and analyzing it in a central lab. This method is highly accurate and is used for diagnostic purposes such as confirming diabetes with fasting plasma glucose or oral glucose tolerance tests. Point-of-care devices are similar to home glucometers but are designed for use by healthcare professionals in a clinical environment. These devices are valuable for monitoring patients during surgery in the intensive care unit or when rapid results are needed. Proper technique is crucial for accurate blood glucose monitoring. Regardless of the method, always use clean hands and equipment. Avoid using the first drop of blood if your hands are not clean, as it may be contaminated with food or other substances. If you have poor circulation, warming your hands or massaging your finger before lancing can help obtain a sufficient blood sample. Rotating testing sites helps prevent soreness, bruising and callus formation. Some meters allow for alternate site testing such as the palm or forearm, but these sites may not reflect rapid changes in glucose as accurately as fingertip samples. Always use the fingertip if you suspect hypoglycemia or need the most accurate reading. Understanding your blood glucose results is key to effective diabetes management. Target ranges vary depending on age, health status and individual goals. Your healthcare provider will help you determine your personal targets. Generally, fasting or pre-meal glucose should be within a certain range and post-meal readings should return to target levels within a few hours. Consistently high or low readings may require adjustments to your diet, activity or medications. Hypoglycemia or low blood glucose can occur if you take too much insulin, skip meals, exercise intensely or drink alcohol. Symptoms include shakiness, sweating, confusion, irritability and in severe cases loss of consciousness. Monitoring allows you to catch low levels early and treat them promptly with fast-acting carbohydrates such as juice or glucose tablets. Hyperglycemia or high blood glucose can result from missed medications, overeating, illness or stress. Symptoms may include increased thirst, frequent urination, fatigue and blurred vision. Persistent high levels can lead to serious complications such as diabetic ketoacidosis in type 1 diabetes or hyperosmolar hypoglycemic state in type 2 diabetes. Monitoring helps you identify high readings and take corrective action such as adjusting medications or seeking medical advice. Sharing your blood glucose data with your healthcare team is important for ongoing care. Many meters and CGM systems allow you to download or transmit your data electronically. This information helps your provider assess your control, identify patterns and make recommendations for changes to your treatment plan. Bring your meter or logbook to appointments and discuss any challenges or concerns you may have. For children, adolescents and older adults, special considerations apply. Children may need help with testing and interpreting results, while older adults may have vision or dexterity challenges that require adaptive devices or assistance. In all cases, the goal is to empower individuals to manage their diabetes confidently and safely. Travel and daily routines can affect blood glucose monitoring. Plan ahead by packing extra supplies, keeping your meter and strips at the correct temperature, and having a backup plan in case of device failure. When traveling across time zones, work with your provider to adjust your testing schedule and medication timing as needed. New technologies continue to improve the convenience and accuracy of blood glucose monitoring. Non-invasive devices that measure glucose through the skin or other body Fluids are in development and may offer alternatives to fingerstick testing in the future. Smartphone apps, digital reminders and cloud-based data sharing are making it easier than ever to track and manage blood glucose. Education and support are vital for successful blood glucose monitoring. Diabetes health management education programs teach the skills needed to use monitoring devices, interpret results and make informed decisions about food activity and medications. Peer support groups and online communities can provide encouragement and practical tips for overcoming challenges for healthcare professionals supporting patients with diabetes. It is important to provide clear instructions on how to use monitoring devices, review technique regularly and address any barriers to effective monitoring. Encourage patients to ask questions and express concerns about pain, cost or device use. Work together to create a monitoring schedule that fits the individual's lifestyle and goals. In summary, blood glucose monitoring is a cornerstone of diabetes care. It empowers individuals to understand their bodies, respond to changes and prevent complications by mastering the techniques of self-monitoring, continuous and flash glucose monitoring. Understanding how to interpret and act on results, people with diabetes can live healthier, more active lives. Ongoing education, support, and advances in technology will continue to make blood glucose monitoring more accessible and effective for everyone living with diabetes.